Every year, October 10th is celebrated as Mental Health Day. It's an international day for global mental health education, awareness, and advocacy against social stigma. And yet, despite some people's efforts, it seems like mental health issues have long been a taboo subject in India. But maybe there seems to be rising awareness among younger generations, maybe coupled with the seismic impact of the COVID-19 pandemic. So, there may be a more open and accepting conversation about mental well-being brewing. But do mental health issues affect Indian companies? According to a 2022 report by Deloitte, poor mental health has a profound impact on the workforce. The report estimated that poor mental health among employees cost Indian companies about $14 billion annually. The $14 billion price tag is attributed to things including absenteeism, attrition, and lost productivity. Close to 50% of those surveyed were said to consider workplace-related stress as the most significant factor affecting their mental health. Financial challenges and the lingering effects of the COVID-19 pandemic were said to closely follow. Close to 40% of affected respondents were said to have refrained from taking any steps to address their mental health issues due to societal stigma. The World Health Organization estimates that globally, poor mental health costs the economy $1 trillion annually due to lost productivity. India is no exception, with the 2019 WHO estimate projecting economic losses of $1 trillion between 2012 and 2030 due to mental health conditions. And at the time, it may not have had any idea that the COVID-19 pandemic would exacerbate mental health issues. So maybe with that information, the economic losses projected could have been higher. What about beyond the workplace? The ripple effect of mental health issues may be reaching Indian households. A March 2023 study found that nearly 20% of a family's monthly expenditure goes towards healthcare if a member suffers from mental illness. This revealed that this financial burden pushed around 20% of households below the poverty line. One critical issue in mental health may be that many who need help don't receive it. This could result in chronic issues and more extensive suffering. Maybe the workplace could encourage open conversations and raise awareness about the prevalence of mental health issues. Companies could play a pivotal role in fostering a supportive environment for their employees by investing in programs and resources that focus on employees' mental well-being, such as counseling services and stress management programs. At a school level, maybe incorporating mental health education into school curriculums could help cultivate a generation that's better equipped to understand and manage their mental health. This proactive approach could contribute to long-term well-being. Could the Indian government and Indian healthcare systems ensure that mental health services are readily available and financially accessible? And building supportive networks and communities for people dealing with mental health challenges could be crucial. Peer support groups and online platforms could provide a sense of belonging and understanding. As awareness grows and attitudes shift, can India have a more inclusive and empathetic approach to mental health in the future? If this is an economic imperative for India's future, what can be done to tackle mental health issues head on? What does it take to tackle this invisible but substantial crisis?